Now, the mainstay of treatment, and I don't think there should be any discussion of any procedure without this discussion, would be that the mainstay for BPH treatment should be medicine. This is what we always try first. Now, a man can say, I have side effects with medicine. A man can say the medicine's not working for me. A man can say, even though it's working for me, I don't want to be on a chronic medicine. But I do tend to take objection to people that are offering procedures in the absence of medication. I know you see that sometimes in the philosophy of Urolift. What I tell patients is, I'm going to start you on a medicine, and if you're happy, I'm happy, and they don't get pressured in any way to do a procedure. Procedures are just if patients ask me for more symptomatic relief than medicine can provide. The medicines in some patients' minds starts sometimes with herbal medicine. Maybe we've heard of saw palmetto. That's the most common herbal thing. We tend to rely, we urologists mostly rely on medicines called alpha blockers, and the most common one there, these are non-generic names, is Flomax or Tamsulosin. The one I tend to use because it has less effect on your ejaculation is called Uroxetrol, not a very pleasant name. It's otherwise known as Alfuzacin. There's another class of medications called 5-alpha reductase inhibitors. These were the first ones out there. They just don't work very well at all unless you have a really big prostate. We may remember them as Proscar. There's another one called Avogart. Proscar, in fact, was shown not to work compared to an alpha blocker, and they turn most of their focus at that point on hair loss. So that's called Propecia now because it tends to grow a little bit of hair. But you will find this progression. Different urologists will offer procedures at different steps along the way. I tend to bring up a procedure or offer it if a person has failed an alpha blocker pill. Some people will say if you fail one, then go on 2 alpha blocker pills. And then if that doesn't work, take a 5-alpha reductase pill. I don't have a lot of patients that progress to that because I find that when they're offered something as easy as a Resume, which takes a minute or two in the office, they generally choose that over taking more medicine if medicine's not really helping them. I find, for me, taking more than 1 alpha blocker pill or adding a second or third pill, it really just means the man is not going to have a procedure no matter what. And in that circumstance, there's nothing to lose by taking more medicine. But generally, if you're not doing well on the initial alpha blocker, the addition of more is not going to have a huge effect. And eventually, the patient should be offered a procedural alternative.